We lost a patient this morning, a young guy that was really heartbreaking. He has 3 young kids. I cried, I had a little meltdown, took a deep breath, and went back to work because that's what we do. This is our calling, not just our job. Time to start the day again. Every morning and every night, I'm taking my temperature to make sure I stay healthy to take care of my patients. And I'm good, ready to go. See you at the hospital. So the unit that I work in is a COVID quarantined critical care unit. The sickest patients that we have in the health system right now. Average age is in 50s. People are 20, 30, 40, 50. Much younger than we expected. Much less comorbidities. There is a lot of emotions going on right now. They're tired. They're ready to go home. They had a long night, getting another admission into the ICU now. So it's 5:05 in the morning in the ICU. We're getting our first admission. Patient from the floor that requires to get the ventilator for the breathing machine.
So this is the mechanical ventilator. We have all the patients in the ICU on it. And a lot of these patients with COVID-19 are on a lot of oxygen. The PEEP is actually helped to keep the lungs open and expanded to help them survive.
There's definitely stressful moments, but I think as a group we're holding strong, and definitely some swings of emotion, but I think that we're hanging in there and we're doing well. Very impressed with the camaraderie and the support of all the team members and how well they're working together, donating extra time and hours here to definitely make a difference. I'm very proud.
So right now we're in a patient's room. We're about to turn him onto his belly to help his oxygen improve. He's not doing very well. We're not able to oxygenate him well. So we have to have a team. We're going to turn him onto his belly to help him oxygenate better. This is our social worker FaceTiming with the family. Majority of our patients are on sedation and can't really respond, but at least the families get to see them. So Dr. Gottesman and I are on our way downstairs to an emergency. So it's 10 a.m. and I've been off the unit for about 2 hours now, responding to emergencies on the floors. I can't believe it's only 10 o'clock in the morning. I'm walking back onto my unit, taking a deep breath to refocus on patient care because that's priority. One of the units that I was just in did tell me that they discharged 60 people, which is always wonderful to hear from an ICU standpoint because what we're saying is very different. So I'm by one of the nurses' station right now, and we have the doctor just watching in the room to make sure everything's going okay with the nursing staff inside. We also have 3 of the nurses here on standby just in case of an emergency.
We're about to start ECMO on a patient. We're unable to give the patient enough oxygen via the mechanical ventilator. So now we need to bypass the lungs, and this machine will purify the lungs and then give the patient oxygen while his lungs are healing.
It's only 12 o'clock and I needed to take a deep breath in a moment for myself because a patient had just passed away and I had a nice relationship with the wife who has 3 small kids and he was in his 40s, my age, and he just passed from COVID. It's been a rough morning. Living for the support of my staff and the community. It's been amazing and really helpful in this whole thing. It's just we have these moments that we need to just break down and have a moment for ourselves. This used to be our auditorium. Now it is a new unit to hold patients. They've put in sinks on the stage, machines to take out medication, The innovation is amazing that's going on here at the hospital to try to take care of as many patients as possible. So I'm standing in front of this room with one of the ICU doctors, and we're just talking about how we're feeling emotionally and physically, trying to take care of each other. How are you feeling?
Yesterday I went into my house and my 6-month-old, he just started crawling about a month ago. And he started beelining toward me. And I tried to sneak up to the stairs before he could get to me. But he started crying really bad. So I jumped in the shower and I held him for about 10 minutes after that.
And how good did that feel?
It felt so good. I broke my own rule for about 10 minutes.
All right. Well, you know what? You're rejuvenated for today?
Yeah.
There you go. God bless. Woo! Someone's getting extubated. Woo! Someone's getting extubated. Oh, that's such a great feeling. Someone's coming off the ventilator when we hear, "Here comes the sun" overhead. Yay! Good job! Yay! We got a thumbs up! I got a thumbs up! Yay! Someone's going home! Yay! Yay! So my partner and I are walking through another ICU to go help start someone on renal replacement. We just heard chimes overhead, which is great. That means someone's getting discharged. So in the ICUs, it's a little different, and hearing those chimes make it so much easier and make us much happier. So we need to look at the positive, because there are a lot of people going home. Sometimes we have family members that are in the hospital and makes this situation even more stressful. There's my family member on his way home. So excited. He's going home. We just took the breathing tube out of the patient. We had our second extubation actually of the day. So we're doing great work. So thanks, guys. So it's 4:30 in the afternoon, and the end of my shift is nowhere in sight. We just got 6 new admissions in another ICU that we just opened, but we all helping each other and getting through it. I'm in a different ICU because we have filled up the ICU that I work in, and now starting to come down here to a different ICU. The ventilator's on standby, ready for a patient. The tube goes into the patient's mouth, into the patient's lung, and inflates and deflates the lungs to help you breathe. So I wasn't gonna blog this, but I'm actually have some tears and crying right now because I'm so tired. But I'm gonna take a deep breath and keep going on. I think I just needed that, a little letdown. But now I'm gonna continue on and powering through back into the unit to stay strong. So this is Jolie. She's our nurse practitioner director. Why do you think the community is so important, Jolie?
Well, coming to work every day and seeing the acuity of these patients and how sick they really are, it really puts a dent in our souls as healthcare providers. Knowing that the Girl Scouts have sent us bracelets, the community is sending us food, children are making pictures for us, it really helps us to go on every day. The community is actually involved. Although from a distance, it helps us get through the day and know that we're not in this alone.
So it's 6 p.m. and I'm about to finally change my scrubs and hopefully go home. Today is day 5 of a 13-hour shift week. I usually do 3 days a week. I'm up to 5 13-hour shifts this week, and I'm tired. So I'm about to change my scrubs to head home to see my babies. Best feeling ever, pulling into my driveway. Can't wait to see my kids. So this is my little decontamination center. My Purell, my Lysol wipes, my garbage. Take my scrubs off, and there's my kids. There's my kids and my husband, which he's probably gonna hide. There he is. Hi, Mom. Hi, guys. I'm home. So this is the best part of my day, coming home and seeing my kids, and coming home to a home-cooked meal. My husband's been amazing, and thank God he's been home because the stressful day is always relieved by coming home to seeing them. We need your help to please stay home, practice social distancing so we can decrease this curve and get rid of this deadly virus. Please, I beg you, help us help you.